From Washington, D.C., this is the Muslim News on Muslim Network TV. Assalamu alaikum, I'm Hena Zuberi. Our top story tonight, New York Governor Cuomo. An independent investigation reveals that New York Governor Andrew Cuomo sexually harassed multiple women. The finding comes 5 months after New York Attorney General Letitia James tasked an independent commission led by 2 outside attorneys with investigating widespread claims. The probe determined Cuomo retaliated at least against 1 former employee for coming forward with her claims. The findings will likely play into an ongoing investigation within the state legislature to determine whether there are grounds for Cuomo to be impeached. He has denied all allegations, claiming that's not who he is. The United States has reached a milestone as 70% of adult Americans have been vaccinated for COVID-19. The development is about a month behind Biden's goal. Even with this good news, Florida and Texas together account for 1/3 of all COVID cases in the U.S. Despite the number of cases, White House Press Secretary Jen Psaki said the country is not going back to the shutdowns of March 2020.
We've been clear we're not going back to the shutdowns of March of 2020. We're not going back to the economy shutting down. We've made too much progress. Too many people are vaccinated. There's been too much progress on the economic front. But again, he has said from the beginning that we are going to be guided by the science, guided by our public health experts, and we're not going to take options off the table of what they may recommend.
Worldwide, cases are approaching the 200 million mark, while over 4 million people have died of COVID-19. In Australia, authorities have been struggling to stop the spread of the highly infectious Delta variant. In Sydney, the country's military has joined police on lockdown patrols. Soldiers are assisting in several home isolation checks. They're enforcing stay-at-home orders during the city's lockdown. The households of 60 million children in the United States have already received President Joe Biden's child tax credit. But about 4 million or more are likely to fail to get the funds because they don't appear on a prior tax return. The Center on Budget and Police Priorities say that the total amount of unclaimed government funds may amount to $13 billion. It's likely that families who haven't yet received child payments by check or direct deposit also didn't receive other stimulus payments, falling into greater need. 2 more Washington, D.C. police officers who defended the U.S. Capitol on January 6 allegedly died by suicide. That brings the total number to 4. The officers were among those who faced down a violent attack by supporters of former U.S. President Donald Trump. 43-year-old officer Gunter Hashide was found dead at his home last Thursday. He joined the Metro Police Department in May 2003. Before him, Metropolitan Police Officer Kyle DeFreytag was found dead on July 10th. DeFreytag had been with the department since November 2016. House Speaker Nancy Pelosi, in a statement, offered her deepest condolences to the family of Officer Hashide. Thousands of Trump supporters invaded the Capitol to stop the congressional certification process of President Joe Biden on January 5th and 6th. About 140 officers from both the Capitol Police and the D.C. Department were injured in the attacks. Most Americans, including half of young Democrats, disapprove of President Joe Biden's handling of the recent Gaza crisis. A significant number of Democrats pin the blame for the Gaza crisis on Israel, far more than on Palestinians. This was despite the fact that President Biden took a decidedly pro-Israel tone during the forced removal of Palestinians from their homes in parts of Jerusalem in May. Overall, more than 50% disapproved of the president's handling of the crisis. The University of Maryland conducted the survey from June 22nd to July 21st. President Biden refused to publicly criticize Israel's action or even push for an early end of the crisis. For this, he faced criticism not just from Democratic progressives, but even from pro-Israel Democrats in Congress. A little over 8% of Democrats pinned the blame for the crisis on Palestinians, while over 34% blamed Israel. Over 52% blamed both equally. The poll was conducted amongst a national poll of 3,379 respondents, with a margin of error of, give or take, 1.69%. In a surprise move, Democratic Representative Ilhan Omar voted for continuing $3.3 billion in unconditional aid to Israel. The Progressive Caucus at the House was split on the bill. Democratic Representatives Omar, Ayanna Pressley, Jamal Bowman, and Pramila Jayapal voted in favor of the bill along with other Democrats. Rashida Tlaib, Alexandria Ocasio-Cortez, and Cori Bush, on the other hand, voted against it. The bill passed narrowly with 217 for and 212 against. All members of the progressive group of lawmakers known as the Squad are highly critical of Israel. They have previously called to end the many decades of America's unconditional aid to Israel. The Squad's failure to vote as one is seen as a missed opportunity to strike at a major blow to Washington's unconditional support for Israel. This bill has also taken aim at BDS, the global boycott, divestment, and sanctions campaign against Israel. It describes BDS as an international effort to stigmatize and isolate the country. The bill demands an annual report to Congress on the BDS campaign. The American Israel Public Affairs Committee, or IPAC, welcomed the passing of the bill. It said the critical funding with no added political conditions reflects the strong bipartisan support for Israel's security in Congress and the Biden administration. The Taliban confirmed a CNN report that they have taken over a television station in Afghanistan's strategic Helmand province. It marks the latest of a series of advances by the Taliban. This incident comes as the United States has ramped up airstrikes against the group. It is in a bid to turn back the Taliban's advances on a number of key provincial capitals in Afghanistan. In related news, the U.S. State Department said it has expanded eligibility for refugee visas to Afghans.
So today, the State Department is announcing a new resettlement program for Afghans who assisted the United States, but who do not qualify for special immigrant visas. We've created a Priority 2, or P2 designation, granting access to the U.S. Refugee Admissions Program for many of these Afghans and their family members.
The expanded eligibility will include Afghans who work with U.S.-based media organizations or on projects backed by U.S. funding. However, these Afghans will need to find their own way out of Afghanistan and support themselves during the lengthy process. In the meantime, Afghanistan's President Ashraf Ghani blamed the country's deteriorating security Monday on Washington. He said this was because the U.S. abruptly withdrew its troops. While addressing the Afghan parliament, he added that he had warned Washington the withdrawal would have consequences. Indonesian Vice President Maruf Amin said at least 605 imams have died due to the coronavirus as of July 7th. He said the deaths of Muslim experts was a huge loss to the country as they had contributed much to religious education, leaving a hole that cannot be patched. Indonesian Health Minister said on Monday that most coronavirus-related deaths were of people who had not been vaccinated. About 47 million people in Indonesia received the first dose, while over 20 million are fully vaccinated. Indonesia has also recorded the world's highest daily death toll over the past few days, surpassing Russia, Brazil, and India. The Indian parliament for days continued to witness protests and disruptions from opposition lawmakers over the government's use of Israeli spyware Pegasus. On Tuesday, both houses of parliament were once again adjourned due to protest. The opposition members of the chambers continued to demand that the parliament discuss the Indian government's role in spying on its opposition. The opposition says that the names of several Indian politicians, journalists, lawyers, and activists have appeared on a leaked list of potential targets. This was for surveillance by an unidentified agency using Pegasus spyware. Indian Prime Minister Narendra Modi has refused to address the use of Pegasus to spy on Rahul Gandhi, the main opposition leader, Modi's critics, and journalists. Modi branded the protest as an insult to parliament. The Indian Supreme Court is expected to take petitions seeking an independent probe into allegations of the use of Pegasus software. Can Gaddafi's son save Libya? For years, mystery surrounded the disappearance of Gaddafi's son, Saif al-Islam. Saif is in Libya and he intends to run for president. More details in this report by Ali Khalaf and Saleha Farouk.
President Bush attacked Iraq to dismantle weapons of mass destruction. Those weapons were never found. Later on, Bush says that Iraq was his biggest regret. Too late for the Iraqis.
There are moments where you make mistakes.
President Obama invaded Libya in 2011. He also regrets it as the major mistake of his presidency. As Vice President Biden thought the war would create a vacuum in Libya that would be filled by extremists, he was right. Gaddafi was deposed, sodomized, and murdered following a US and NATO bombing campaign. 10 years later, militias, civil war, and thugs still define Libya. Now Gaddafi's son thinks that he is ready to fill that vacuum. Saif al-Islam is the second son of the country's late dictator Muammar al-Gaddafi. He was captured by a band of armed rebels in the Libyan desert town of Aubari. He was fleeing toward Niger. The rebels were clever enough to keep him as a valuable hostage. They hide him in a cave-like basement in Zintan. Now this rebel group, frustrated with the Libyan situation, have not only freed him, but hope that he can lead Libya. With their help, Saif al-Islam is now organizing a political return. Libyans are fed up with the state of affairs. The country is in shambles. Militias are fighting each other. Human trafficking is thriving. The oil-producing country does not even have electricity. Water is costlier than gas. The Gaddafi days they rebelled against seem better now. So, Saif al-Islam is thinking of running for presidency. Will democracy bring back another dictator? Only time will tell.
Coming up next after the break is our in-depth analysis segment, so stay tuned and we'll be right back after these messages.
To get inside each other's minds. Walk a mile in my shoes. Walk a mile in my shoes. Well, before you abuse, criticize, and accuse. Walk a mile in my shoes.
Despite the development of a COVID-19 vaccine, millions around the world will not have access. We need a vaccine that's free and available to everyone, everywhere. It's time for a people's vaccine.
Welcome back. Muslim adults in the US are twice as likely to report a history of suicide attempts compared with individuals from other faith traditions. This was the finding of a survey report which we shared in our show last evening. Lead of this survey is joining Saleha Farouk for a detailed conversation. Over to you, Saleha.
Thank you so much and welcome to the program. Today I'm very happy to be joined by Dr. Rania Awad, who is a practicing psychiatrist as well as a clinical associate professor based at the Stanford University School of Medicine, as well as the commissioner of this study that we'll discuss today. Dr. Rania, thank you so much for being here with us today.
It's my pleasure. Thank you so much for having me.
Now, this very interesting study about suicide rates by faith was undertaken by the Stanford Muslim Mental Health and Islamic Psychology Lab. What was the catalyst or need behind this study? We wanted to understand.
Absolutely. Well, first and foremost, this is a very difficult topic to study. Mental health in general is very much stigmatized still, and for many communities, especially Muslim communities, a taboo subject. Suicide I consider to be a discussion that is a taboo within a taboo. In the literature, when we look at who, if there are really findings about Muslims, there's very, very few studies that talk about suicide, and much fewer talking about the population we studied, which was the US or American Muslim population. So we were really filling a research gap to understand what exactly was happening, because anecdotally and clinically in our practices as mental health professionals, we were finding that the rates of suicide was really going up, but we didn't have the scientific evidence and proof to really understand what was really happening. So that was part of the catalyst of the study.
Thank you for that insight. Now, this study has indicated that American Muslims had twice the rate of suicide attempts as members of other faiths, as well as non-faith groups. Understanding, of course, that this is definitely not a black and white issue, what can be analyzed about this situation?
What we can definitely say so far is a very important aspect, which is we studied suicide attempts, which is very different than deaths by suicide, or what we call completed suicides. The reason for that is because the literature still shows that Muslims have the lowest rate of death by suicide. But the suicide attempts, which we looked at, was, as you mentioned, twice the number of any other faith group or even non-faith groups, which is very concerning. We're really concerned about a reversing trend potentially. It doesn't necessarily mean that the increased suicide attempts will mean increased death by suicide, but one can definitely lead to the other. And that's the reason we're focusing on this a whole lot more. So that's part of the analysis here, definitely. Another important aspect of our analysis was looking at religiosity. And we, in our measure, we looked specifically at people who were self-identified religiosity, how they themselves identified with levels of religiosity. And we found that it didn't actually make a difference. That's very important because it changes a little bit of the discussion, especially in our communities, where we always talk about how faith alone can protect against suicide. And actually, that is not true, not scientifically, nor is it even in our faith or deen. Actually, there are many measures that one must take for well-being, and only one measure of faith or spirituality alone is not enough. So that's a very important finding as well.
Now, there are numerous similar studies about high mental health challenges and mental health different rates within ethnic as well as racialized minority populations. So would it be okay to understand if there's a link here between mental health challenges and the rate of suicidality in the way that you mentioned, which is the attempt and not necessarily actually going through with it?
It is. I would say that the rates of suicide in general, whether they be attempts or death by suicide, is definitely higher, we find, in minority or marginalized communities. And part of the reason for that is, as you can probably understand, that if a person feels that they are not part of the very fabric of that society, they're experiencing a lot of different forms of trauma. Perhaps they are even vilified. And for Muslims, we often talk about Islamophobia, and also just other traumatic incidents and aspects in their personal lives, or perhaps in the home countries from which they immigrated from. These are all things that can actually lead to heightened stressors, and heightened stressors does have a correlation with heightened levels of mental health conditions, which also has a heightened level of suicidality as well. So these are important aspects, and they shouldn't be seen individually. They actually need to be seen all together, and in fact, treated and worked on all together.
You also spoke about how suicide response efforts should preferably be tailored to different faith-based populations. Why is this important, and how does it compare to current available resources in this regard?
Absolutely. And this is part of really what I call part of the passion really for me in working in this taboo within a taboo of a subject, is really because I felt in what was available in society at the moment is really either a discussion on suicide from a very scientific, secular, non-faith-based aspect, or if it is addressing faith, it's addressing it from a different faith perspective than the Muslim perspective. And that was there was such a big gap between what Muslims were able to really understand and feel comfortable with. So what I felt was really important in some of the work we undertook at the lab, the Stanford Muslim Mental Health and Islamic Psychology Lab, was actually developing a manual that would address all of the evidence-based current scientific, cutting-edge research on the topic of suicide, but integrate that fully with the understanding of Islamic ethics, Islamic morals and values, and our belief system, which is really crucial because you have to have the both kind of wedded together in order to really help the community. These are now developed into modules and certificate-based trainings, which we have an entire campaign as part of the nonprofit of the lab called Maristan. Maristan.org is actually where we're going to be doing these trainings that are specific to the Muslim community. We have a 500 imams campaign right now that is focused on training our imams, our religious and community leaders in the Muslim community on specific custom-tailored ways of working with suicide, whether it's at the level of prevention or the level of intervention, if it's happening right there at the moment with somebody that's in the community, or in the unfortunate aftermath of the postvention, which is what we call crisis response. This is very unique because if you look at the Muslim faith, there are aspects of our faith that need to be taken into account, whether it's the funeral prayer, the janazah prayer, the burial rites, the ability to pray on the deceased, and really the grieving of the community. These are all very unique and specific to Muslims. So if you give a very generic kind of suicide training or a generic discussion, it doesn't necessarily really work for our community as well as it could. So that's the work that we do at the lab and now with the nonprofit, the Maristan, to really be able to increase our suicide response efforts in our Muslim communities and make sure that it really is hitting the mark, as we say.
Thank you for that background. Now, you touched upon this a little bit, and maybe it might be worth delving into a little bit more. What might be the various societal factors that might lead people to having mental health challenges that might eventually lead to rates of suicidality, as was analyzed in your report?
So the first thing I should say is that our specific report did not look at those measures. So this is really important. So what I can offer you is really understanding of all the other literature that's in, at the moment to be able to understand what Muslim stressors are, as opposed to this specific study. So in upcoming studies, we do hope to look deeper into what exactly those issues were. But in general, in the literature, what you find is that with Muslim mental health and their stressors, there's definitely high levels of rates of Islamophobia, and how over 60% of Muslims here in North America say that they have been at the other end of hate crimes or just dealing with different aspects of Islamophobia. You also find that there is a number of people who have had trauma, whether from their own home countries or their personal lives. There's also issues related to being able to fully feel that they are in a land that they are safe and sound in, and that they are welcomed here. Then there are aspects of mental health that are not specific to culture or faith or religion. They are really just a human condition. We know 1 in 4 people, so that's a good number of us in all communities, not just the Muslim community, are going to have some level of mental health concerns, whether it be a serious mental health condition or a mild or moderate mental health condition. These are all things that are going to happen just biologically or genetically, or what families pass down. So when you look at all of these aspects together, yes, Muslims may have more stressors, just like other people from other marginalized communities, more stressors. But at the same time, there are aspects of mental health that all humans deal with. And I think as a community, as a Muslim community, we need to also come to that understanding and realize that we're not immune to the other conditions that other communities deal with as well.
On a very general level, it can be said that general attitudes towards mental health and getting the right help that one needs might be changing, and more people might be seeing that as more normalized as time goes on. Are these attitudes the same within such marginalized, ethnic minority, racialized, or Muslim communities? Are these viewpoints the same? Is the attitude generally changing and more optimistic?
We have a study actually where we just looked at attitudes and perceptions to mental health in the Muslim community. It was a global study, so we had understanding kind of across the US, North America, but also in other parts of the world. And yes, as you mentioned, there is a shift, and I would say alhamdulillah that there is a shift in looking at mental health in a better light. Definitely we find now that there's some data coming out that I would say the younger population generation who are more recipient to mental health discussions, and also those who have, are willing to try this, what often in our community we feel is kind of a new thing. Mental health being a new thing is not really a new thing. And that's part of the research we do at the lab, as well as a lot of, and the nonprofit Meristan, is a lot of the revival of what our deen, our Islam, has already had in its understanding from the very beginning of Islam, which is mind, body, and soul, really having all aspects of health and wellness in place. And that kind of revival of understanding is leading to the revival of the field called Islamic psychology. It's also leading to the revival of institutions like Meristan, who are really reviving what Muslim civilization had and heritage had for centuries, which is really these healing centers that focused on not just the body, but also the mind and the soul. And I think when you see that kind of revival happening, yes, there is definitely a movement forward, but we still have a very long way to go. I think there's many other members of our Muslim communities and generational gap really in understanding mental health that needs to still be bridged. But I'm hopeful. I'm really hopeful we're starting to move in the right direction, inshallah.
We really wanted to be advantageous about the fact that we are speaking with a psychiatrist here today. If you had any advice or perhaps any resources that you'd like to point out for anyone, whether Muslim or non-Muslim, that might be having certain challenges with their mental health that you could maybe highlight as we conclude today.
Yes, definitely. I would actually like to point to a website that I think has a lot of really great resources. It's a new website, as I mentioned, part of the lab is now our community-facing website. It's Meristan, MARISTAN.org. And if you go to that page and go to /resources, there is a list actually of directories across the US, Canada, and really globally on providers, Muslim mental health providers. We often get this question, how do I find a Muslim mental health practitioner if I feel that myself or my loved one needs some assistance? I also want to mention that since we discussed the topic of suicide today, and I realize that could be a triggering and difficult conversation, here in the US, there is a national 24/7 hotline for a crisis line for the topic of suicide that somebody will definitely pick up and help, that I would like people to know of, and also the same as in Canada. I also would like to say that there are Muslim services for crisis response. So these are programs such as Nasiha Hotline and Amala Hope Line. And I really hope that people do take advantage of being able to call and on the other end have a Muslim who's able to pick up and, in a moment of a pinch or a crisis response to help. And I hope between all of these resources that this is helpful for people to know. If folks here who are listening happen to be on social media, there's some really wonderful resources there at the handle of the lab, the Stanford Muslim Mental Health and Islamic Psychology Lab, if you look us up, and also the handle for Meristan, which we put out a lot of really strong evidence-based mental health research and findings based on the Muslim community, but fully integrated with the Islamic understanding. So I do hope all those resources will be helpful and useful.
Speaking here today with Dr. Rania Awad, who is a practicing psychiatrist as well as a clinical associate professor based at the Stanford University School of Medicine, as well as the commissioner of the study that we had discussed today. Dr. Rania, thank you so much for your valuable time with us.
It's my pleasure. Thank you so much for featuring this.
Back to the new studio.
Thank you, Saleha. We really don't know the state of a person when they reach this point in their life, and we really don't know what their mental state is, so only God can judge. Before moving on to our next analysis, let's take a quick break, and we'll be right back after these messages.
Our fellow Americans.
Right now, the COVID-19 vaccines are available to millions of Americans.
And soon, they will be available to everyone.
The science is clear. These vaccines will protect you and those you love from this dangerous and deadly disease.
They could save your life.
So we urge you to get vaccinated when it's available to you.
That's the first step to ending the pandemic and moving our country forward. It's up to you.
Dad, they took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3.
you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
Welcome back. In our show yesterday, we discussed the news of a surge in COVID cases in Florida. The state has become the worst hit with COVID-19 in the United States. To discuss this in detail, let's go to Imam Abdul Malik Mujahid. Over to you, Imam Mujahid.
Thank you, Hena. Florida again is breaking COVID records. Florida and Texas have 1/3 of all new cases in the United States of America. But the governor, however, is calling it a media hysteria. We have someone from Florida who is a physician, Dr. Shakil Ahmed. He's a physician and a chair of the board of directors of American Muslim Community Centers. So welcome to Muslim Network TV.
Thank you for having me here. Assalamu alaikum.
Wa alaikum salam wa rahmatullah. So what do you see as a physician going on there? Is it a media hysteria or is it really some issues there?
Well, actually, it's a real issue. Florida is going back to where we were back about a year ago. I think if you have seen the news, the number of cases in Florida have broke the record, and we have 11,500 cases in the hospital of COVID-19. And about almost less than a quarter of these cases are actually in ICU. So Delta variant, if that is Delta variant causing it, although we don't have data, but we have firm belief it is causing havoc. It is not hysteria at all. It is not a creation of mind of the media. I think our politicians need to take a tour of our ICUs and the hospitals to see what the reality is on the ground, rather than just sitting in a mansion and calling these statements. It is looking pretty bad. And right now the hospitals are scrambling and trying to find out how do they staff, how do they cope with this kind of an emergency, which in the past 3 weeks have come all of a sudden. I mean, it just engulfed the entire state. Every single hospital is at capacity for COVID, and a lot of them, one which I go locally, they have been just talking about the numbers going up terribly. We had about 57 cases in this small hospital, which is a lot more than what we had last year. So I think we have to keep the politics aside and focus on the healthcare and the health and the well-being of the people in society in general.
So your ICU still have some capacity or it's full capacity?
ICU still has capacity. And what we're trying to do, we're using the other rooms as ICU, and we're trying to use, for example, our PACUs, which are the post-operative rooms, as a little less severe cases, which could be in ICU. But I mean, we are extending our beds elsewhere to make that capacity to happen, because we are anticipating at least about 5 to 10% increase every other day in the cases.
On the daily basis, that's substantial. In Massachusetts, a report came out through CDC that 2/3 of the cases were of those people who are already vaccinated. Are you seeing the same thing? The vaccinated people are getting some milder attacks, or these are the unvaccinated who are populating your hospitals?
They're mostly unvaccinated people. About 95% in the hospital are unvaccinated. There are few cases, but if we look at those, we find that they have other comorbid issues ongoing as well, immunocompromised status and multiple medical problems. And then they're older folks. And most interesting thing, which I have observed and all of us have, most of the cases who are unvaccinated, they're young people. So the average age is like 45, which is a drastic change from the last year when we had the average age more than 60, 65. So these are younger people who are getting infection, and they're getting bad infection. Now their BMIs are high too, means they're overweight, The average BMI, I would say, would be somewhere plus 40 plus. So they're obese folks who have a smaller lung capacity, and they were vulnerable to get infection even last year. But now we're not seeing the older patients as much as we are seeing the younger ones.
Could it be that the older people decided to get vaccinated?
I'm pretty sure that is one of the reasons we are not seeing them. The most of 65 plus are vaccinated in the state, but the younger people, they just decided not to. And it's very hard to convince them. And they are just so fixated on their ideas. They don't even want to go on the ventilator. They say, we give us oxygen, we'll get better. They keep on fighting. I ask them, please get on the vent. They said, nope, nobody gets off the vent. If you get on the ventilator, you die. So that is kind of a fixed ideas people have, and they don't want to change. But then they regret later on. Their families regret later on when they see their loved ones slipping out of the life and get really deathly sick.
I saw in a report that a Florida hospital say that they are hearing panic, fear, and regret from unvaccinated COVID patients. So is this the same case in your hospital?
Yes, we have. Actually, I go to several hospitals, and the main one, the people that I'm taking care of, they are of the same idea. Yes, they're thinking, but it's too late. They've already got the infection, and infection is too far advanced. It is beating their expectation of getting better earlier and quicker, and now they are requiring some sort of ventilator support, either through non-invasive ventilation or regular intubation and mechanical ventilation, which also involves paralysis too. But their families, yeah, that's what they say. I wish we would have got the vaccine, but some of them are still, I shouldn't say hard-headed, because people make the choice. As a doctor, we still have to be compassionate with them and take their side and be their advocates. But yes, I wish they would have made the right choice. And my message to everybody, to be honest, please get vaccinated. It's still not too late, because when they end up in the hospital and it keeps on going in a downward spiral, then it is too late.
Dr. Shakil, Muslim community centers which you're involved with was involved in vaccination. Are you still doing the vaccination?
So we stopped doing the vaccination. We had a very good 9-week campaign in which we were vaccinating almost 500 to 600 people every day at our masjid, at our community center. And then we were going to Oviedo Mall. There's a local mall here in the Seminole County, which there were mass vaccinations were ongoing. So our team was providing the staff support with doctors, nurses, pharmacists, and we were part of like about 2,000 to 3,000 vaccination every single day. We are not doing that anymore because most of the places have opened up the vaccination. There are small local pharmacies like Publix, CVS, and Walgreens. But then doctors' offices are also giving vaccination. So it's now widespread. At that time, there were not too many places giving vaccine.
But now that it is more easily available, are more people coming forward after Florida is showing record cases and record deaths?
No, actually, they're not. They're still sticking to their guns. That's the unfortunate part. And it's all because of the effect of politicians on the mind of the people.
But isn't this ironical that it was President Trump who, funded that Operation Warp Speed, and under them, this vaccine was developed on a fast pace. There were some other problems, not recognizing, delaying, and masking, and all that. But you see, it's a pure partisan thing there.
It's pretty much partisan. If you recall, the previous president was elected on a populist notion. So he was appealing to the people who think that they are not heard, they're not listened. So he would listen to them and just sympathize and agree with them on everything. Well, looks like our governor is just following the same line here to be maybe the next president or whatnot. Although he's a very educated person, and we are expecting that he would do the right thing early and prevent so much death and misery which is happening.
Has he visited any hospital so far during the last week or so when it's suddenly going out of proportion? Is he visiting some ICU to see what is going on there?
Don't think he is. I don't think so. And I think if he is, then he's just probably going to where his party is taking him for the visit. But I mean, it is very apparent. You cannot deny the data. It is right in front of you. It's not made up by the media. Actually, it is the Florida Medical Association just published the numbers, 11,500 yesterday. I mean, that's an amazingly high number. We never had those kind of cases last year. So last year we were like at 10,000 at the maximum in the hospitals. We have crossed that line actually. So this is not any media or NPR or Orlando Sentinel or CNN just showing the data. It is an independent organization, which is the Medical Association of Florida.
Yeah, there was some debate and discussion earlier. There was some lady who worked for the state who was giving more realistic data, and she was arrested and detained. So there is some politics about the data itself. Tell me, I was looking at some photos and images, and I saw a lot of people without masking partying around on the beaches here and there. So is masking is also not increasing despite all these numbers?
No, we seldom ever see the mask outdoors now. They're only the businesses and the private institutes that they're requiring the mask to be mandated when you enter their building. Otherwise, in the public places or in the government facilities, such as schools especially, there is no mandate because I think our governor has said, well, mask is not mandated in the government buildings. So it means that the teachers cannot tell the students, you have to wear the mask. They cannot. It's up to the parents now, which is very sad because students listen to their teachers. And if it is mandated, they will. And they will be spreading this contagious variant, honestly, like we have never seen before. In 2 weeks, it is going to be, we are saying that in 3 weeks, we'll reach another peak, actually, when the schools will open for at least a week period and they will be transmitting more. It is unfortunate that we have to have the mask, and I urge everybody, have your personal mandate for your life. Mask is that important.
So how parents are reacting to governor saying there will be no mask required at the school?
So they are about the same way. Some of them who are not wearing the mask, they don't want their kids to wear the mask. But whoever's listening to the news and looking at all that death and destruction this COVID-19 variant is causing now, they're doing the sensible thing. They have to send their kids to the school because there's no virtual school this year anymore.
Well, thank you so much, Dr. Shakil. Dr. Shakil is talking with us. He's a physician from Florida who has been active in vaccination campaign and now handling multiple hospitals with COVID patients. Thank you so much.
Thank you for having me here. Assalamu
alaikum. Back to you, Hena.
Thank you so much, Imam Mujahid. That's all from our Washington studios tonight. Thank you for tuning in. You can find previous episodes and more on our YouTube or Facebook. For more content, keep watching Muslim Network TV and visit muslimnetwork.tv. Assalamu alaikum and good night.